If you choose to buy health coverage, it'll cost you $400 to $500 a month minimum. So you can see where we're going with this. Now, that tax of $95 a year that is paid in 2015 based on the 2014 tax year is slated to go up to $395 for 2015 and $695 for 2016. So the number is slated to rise. It's still a number that we question whether it will encourage or discourage people to participate in the health insurance market. And a big reason that we question that is because of guaranteed issue. In 2014, there will be no underwriting. There will, an individual will have to be covered regardless of their health condition. And any of you that have heard me speak before have heard me say that we do not believe that guaranteed issue is a deal killer in the group benefits market. We do believe that guaranteed issue with no set enrollment period is a deal killer. There is no actuarial basis for pricing insurance if you can buy the insurance while you're in the ambulance on the way to the hospital. Because if you think about, if any of you have young adults as kids, you think about them getting out of college and they can either pay $400 or $500 a month for health insurance, or they can pay $95 a year to not have health insurance. And while they're in the ambulance, when they've been in that car wreck, you or they can call Blue Cross and say, hey, we need a policy. Pay for a couple of months, they're healed, drop it, pay the penalty, right? It appears as though they're beginning to listen in Washington because we're starting to hear rumblings that they may constrict an enrollment period. That initially, for the 2014 enrollment periods, they're talking about a 6-month enrollment period. That's still very broad. You know, a typical enrollment period for a company is 30 to 60 days. In this case, you're talking about 6 months, but it eliminates half of the people that would otherwise be sick buying the coverage the day that they get sick. They're talking about a 6-month initial period and maybe continuing on through the renewal process 3 to 6 months each year. This is directly attributed to the lobbyists from the National Association of Health Underwriters trying to educate people in Washington about what guaranteed issue with no enrollment period would do to the cost structure of insuring individuals' health. I tell a funny story that Janet Troutwine tells from the National Association of Health Underwriters. In this educational process, if you want to know if the people that represent you in Washington really understand what they're legislating, they're going through, as they're working on this 6-month enrollment period, they're asking all of the staffers from the HHS, from Congressional Office, from the Department of Labor to come up with what exceptions might be offered in this enrollment period. You know, in your group plans, you have open enrollment, but if somebody gets married, gets divorced, has a child, there are certain exceptions where they can get on or off your plan in the year. And they start talking about these things. Well, they got one staffer from the Department of Health and Human Services has suggested that maybe we should have an exception in an enrollment period for people that develop health problems. So I don't think that they really understand what we're going for whenever we talk about guaranteed issue and set enrollment periods. Also in 2014, because of guaranteed issue, there is a new fee that in the last month has been enumerated, which is $63 a year or $5.25 a month for each covered life on a group plan. That is added to the cost of their coverage to help offset the cost of taking people that were previously uninsured and placing them into a guaranteed issue pool. 2014 is also when the state insurance exchanges are to be up and running. So far, 18 states plus the District of Columbia have declared their intent to set up a state-based exchange. 7 states have decided to go into partnership with the government, which basically means that they will set up the exchange, but the government's going to pay the cost of setting up that exchange, and that 25 states have defaulted to have the federal government set up an exchange for them. And this was a shock to Washington that there were so many states that chose to not set up the exchanges. And many of them chose to not set up those exchanges, waiting to see what happened in the election. And then the complaints of many of those states are, if the federal government will come in and pay to set it up, why should we charge our state residents to set up the exchange if we get to run it anyway and they're just setting it up? And so that's where the argument has been. Well, the answer in the last week from CMS and HHS was that because so many states have decided to set up federal exchanges and they're having to pay for something that they didn't think they would have to pay for and that they didn't make provision for in the initial law, that they're going to add a 3.5% user fee to every health insurer, to every covered life that decides to go into the exchange to help set up those exchanges. So an additional cost on top of the ones that we've talked about. One of the most interesting legal challenges out there revolves around these exchanges. The state of Oklahoma, the way that they read the law is that that the law was written very specifically in this area, that in state instituted exchanges, individuals could be charged a penalty for not buying coverage, or companies could be charged a penalty for not providing affordable coverage, and individuals could receive subsidies if they went into those exchanges in state-based exchanges. Oklahoma's argument is that in the states where the federal government sets up the exchange, that the federal government has no right to force their employers to pay a penalty or to pay a subsidy to those that participate in the exchange. And this is huge because you could see all of the additional costs that go into having guaranteed issue and all of the additional fees and taxes that are being stuffed into this law. The idea was that the subsidy would hide that cost for the individual, that somehow the employer would pay a lion's share of that cost, and then the individual, a great deal of their cost in the exchange would be subsidized by the government, so they wouldn't be paying the full cost of their coverage. If the state can't pay a subsidy and they can't collect from an employer that doesn't have an affordable plan, then the exchange idea collapses under its weight. The IRS has said that they have every intention of collecting the tax, charging the fee as though every state had set up their own exchange. And so this is a legal battle that's making its way through the courts right now from the state of Oklahoma. They're fighting that, and where that ends up, we do not know. The phrase penalty management becomes a huge player in our industry in 2014. It's very much what companies have engaged in as regards the tax law for time in memoriam, which is that you find out what the tax law is and you structure your business and your business practices around that tax law. There are many companies that are now doing that with their health insurance plans, that they're different, that the employer has that shared responsibility that if they don't offer a plan that is deemed an affordable plan that covers the requisite amount of benefit, then their employee can go to the state exchange and buy coverage, and the employer has to pay a subsidy in order to offset that cost. So employers are now asking a very important question, which is, do we pay the penalty or do we still play in the health insurance arena? Initially, when the law first came to pass, there was a lot of threats out there from companies to just drop their health plans altogether and pay the penalty. And we'll talk about the penalty in a minute. And you'll see that on its face, it appears as though it would be cheaper to pay the penalty than it would be to have a health insurance plan, but all is not as it seems there. There also, along with penalty management, comes a change in the definition of what a full-time employee is. We now refer to them as full-time equivalent employees. There's a different formula for calculating that based on the Affordable Care Act. It used to be if you had one employee that worked 40 hours a week and one employee that worked 20 hours a week, you had one full-time employee and one part-time employee. The way that the full-time equivalent language reads, if you have that same scenario, one employee that works 40 hours a week, one employee that works 20 hours a week, that's a combined total of 60 hours a week divided among the two of them. Each of them works 30 hours a week, and 30 hours a week makes them a full-time employee. So you now have two full-time employees. And that matters in calculating who you have to cover, or if you don't cover, who you have to pay penalties to the government for. So it changes the definition of a full-time employee, right? And there are obviously most of the questions that we get are around the employer shared responsibility, pay or play, or the full-time equivalent definition and how to make that work. We have employers that have 48, 49 employees that say we'll never get to the 50th. We can assure you of that. And there are several employers that have seasonal workers. And seasonal worker has been defined as if the employee works less than 120 days or works more than 120 days in a year, they're considered a full-time equivalent. But if they work less than 120, then they have an exemption for being a seasonal worker, right? And so you've read the news stories. There are employers that are threatening to cut all of their employees' hours back to 28 hours to make sure that nobody gets 30 hours. There are other employers that talk about separating into 4 different companies so that they don't look like one employer, which incidentally, that's not going to work. It's not going to fly. While states have a problem understanding common ownership, the IRS is set up to understand it, and they do understand common ownership. That's if you've got one person or one entity that owns the majority of 6 different companies, they're going to be treated as one entity for deciding whether they are complying with the Affordable Care Act. Also, employers in 2014 are going to have to deal with a 90-day limit on eligibility waiting periods. So for employers that have high turnover rates, that in the past have made an employee work for 6 months or a year before they get on the health benefits plan, 90 days is going to be the limit as they move forward. There are a myriad of calculators out there to help determine what a full-time equivalent employee looks like, actuarial value calculators to figure out whether the plan matches the minimum benefits. There are pay or play calculators out there. We have been researching all of those, and right now probably the one that is going to be most viable moving forward for our clients is that the Department of Health and Human Services is developing their own pay or play calculator. So they will have the definitive answer on whether a company should pay or play based on the plan. Now, that having been said, when we move, this chart is too small on this slide, so they're going to hand this chart out a little bit larger to you.